I'm Dr. Suzanne Cziraki. I'm an orthodontist, and today we're going to be showing how I do interproximal reduction between the contact points of people's teeth to improve the look of the anatomy of the teeth and also sometimes to make room for tooth movement. I'm using the Invisalign system, and I just want you to have a look here at the computer. And what we see here is the clean check of my patient today. And on the screen, you see numbers pointing between contacts of certain teeth. These numbers tell me how much interproximal enamel contouring that I'm going to do today. So on these three spots, I'm going to do 0.3 of a millimeter or 0.3 of a millimeter, 0.5 or 0.5 of a millimeter, and 0.3. So I'm going to show you how we're going to do that on our patient Brenda today. So let's take a closer look at the anatomy of Brenda's front teeth, her incisor teeth. We see here that the two central incisors have a tapered anatomy. They're more triangular in shape. So as we move towards the gum line, the tooth narrows. When two teeth that have a tapered triangular shape touch one another, we have a very short contact point near the biting edge. As we move towards the gum tissue, we see that the teeth no longer contact one another, and with some gum recession here, it creates what I call a dark triangle, which is, it's not a very nice look. It looks like a person has something stuck between their teeth, and people don't like it, and I don't like it. So how do we correct that? Well, in the Invisalign system, in the design that I've made for Brenda, I have programmed at this stage. What stage are we at, Brenda? Number 7. So we're at number 7 aligner. I'm now going to recontour and shape this contact area so that the teeth will touch further up towards the gum line and diminish the show of this dark triangle. And Brenda, just turn your head this way a bit. We'll see, to a lesser extent, we also have a smaller dark triangle here on the left side and turning to the right, and then a bit of a more pronounced dark triangle here. So that's what I'm going to demonstrate today, how I recontour the teeth to eliminate this dark triangle, and I call that IPR. What I have here are some of the instruments that I use to perform the IPR, the interproximal enamel reduction, or the recontouring of the contact points between certain teeth when I either need to change the anatomical shape of the teeth for more favorable aesthetics and also to bring the teeth together in a more ideal manner, or sometimes I need to lighten or dust the contact between teeth to allow the Invisalign to gently move the teeth into their ideal alignment. These long strips are called lightning strips, and they're a metal background with a matrix of diamond grit on them, and they come in different grit densities, and the strips are different thicknesses as well. I also have discs that have the diamond grit on one of the surfaces, and I use that on a power tool, a slow rotary instrument that I use to polish in between the contacts as well. So I'm going to start with the perforated lightning strip. Brenda, you're going to feel me now flossing this between your teeth, and I'm going to be applying some pressure as I gently contour the surface of the tooth. This doesn't hurt Brenda at all. We don't require any dental freezing. And now that I've made a slight lightening of that contact, I can get a thicker, coarser strip in between the two teeth. And Brenda, you're just going to feel me applying slightly more pressure now. And even, just want to suction away. Even now, with that minimal amount of polishing, you can see if I press the teeth together, we're already diminishing the contact, the dark triangle at the gum line. And now we can take the rotary instrument. Brenda, just hold that, please. Okay. So I'm going to now use the rotary instrument very gently, placing it between the two front teeth. Open just a bit more. And I'm just reshaping that contact point to make it longer and more parallel to its adjacent tooth. Good, that looks great. So you'll see a small gap or diastema will be created between the teeth, but when Brenda puts her aligner on, you won't see that small gap. And over the next 2 or 3 aligners, the gap will be fully closed. It's important when we create these small gaps that our patients have really great oral hygiene so that food doesn't stick in that area. So now you can see the gap that I've created. And let's place the Invisalign tray, aligner, on the top. And I'm going to get you to place it because you know how to do it better. There we go. Good. So right away we can see that the visibility of the gap is diminished when we're wearing the aligner. So the patient doesn't have to feel self-conscious about that slight gap. And it'll be closing in the next 2 aligners. Thank you, Brenda.
The wings are wide, the wings are wide.